In this lecture, we are going to talk about mental health disorders in children and in teens. So as you can see in the slide, we have several health issues that affects mental health, such as hyperactivity disorders or ADHD. We also have anxiety disorders, autism, mood disorders, something about being happy and sad and anxious. So those are mood issues and problem with eating habits. Okay, so we were gonna talk about that in this lecture. So here are four groups. I put it in four groups of different mental health issues that is affecting our young people, the children and the adolescent. So we have here depressive disorders. So we know that in depressive disorders, this is a feeling of being down, okay, not having any purpose in life, just being sad. But when we say depressive disorder, it also pairs with the disorder when the emotion or the mood changes from being down to up or from being sad to happy. So there is a imbalance on this mood, and the manifestation is extreme. So that makes it a disorder. Another group will be anxiety. When you say anxiety, this is a fear, an uncontrollable fear of really unknown cause, or the cause may be known, but the manifestation is extreme. And if the fear is unknown, what makes someone be afraid of something that is not even fearful as a regular thing, we can attribute that as a phobia, or it becomes also a mental health issue when this fear is so severe that it is already causing sleep disorder. It affects a person's functioning in life. It also stops a person from doing his day-to-day living. Now, another group of disorders is focused on the behavior of children. The behavior is disruptive. The behavior is causing disorders or disorganization, and the child cannot control his action. He lacks the ability to figure out to what extent can he manifest such behavior. There is no limit. So we have this oppositional defiant disorder and the conduct disorder. And finally, a group of disorders that affects the neurodevelopment, meaning the growth, the transformation of the brain and its intellectual ability. And so you have the intellectual disabilities. Uh, this person is not able to process things as expected. We have communication disorders. It requires thinking process to send a message, but the problem is this does not um, follow the norm or the usual path, that it does not send a message, or it does not able to convey proper communication. Autism, that is a state whereby a child or a person has some social issues because he or she has issues relating to the outside world. Then we have the ADHD, wherein the child or the person is super hyperactive. The brain is just moving from one to another, that it cannot achieve focus. There is attention deficit. And because of that, the conduct for our day to day activities of living may be affected. We have other learning disorders, and that also involves problem with the motor neurons, which means actions that are overt behaviors that is a reflection on the issue in the thinking process. And we have tic disorders. So let's look at this one by one. Okay. So the among the four, the group that needs focus is the group of disorder that is related to the feelings, the stability of the emotion. And so one of the most common would be, or the one that affects most, um, is the depressive disorder in the children and adolescent. So in this case, the disorder is characterized by sadness, irritability that is so severe that it interferes with one's functioning. Okay? And because it interferes with one's functioning, uh, one cannot achieve what is needed in order to have a peaceful and functioning life. Okay? So, um, the diagnosis, or one would know that there is this condition not just by the present situation, but the history would of this child or this person would show that this depression has been there for quite a while. And management would be giving medication that would reverse the sadness feeling. So you give your antidepressants, but aside from medication, as I have discussed, we go beyond medication. There is a principle that the behavior is a product of the mind, and so we need to do cognitive therapy, uh, therapeutic analysis and management of the thinking process, and hopefully with that structured therapeutic thinking process, the behavior change as a product. That is your cognitive behavioral therapy. Now, that is depressive behavior in children and adolescents. This actually can be defined in various types. We have a disruptive mood dysregulation disorder, meaning the depression is already a combination of a swing from being depressed to being manic, because there is this regulation, and thus it affects the day-to-day of the person or child. We also have the major depressive disorder. This is a deep sadness that now interferes with the overt action of the person, and that depression that continues. It's been with the person or with the child for quite a while. It doesn't go away, and there's no more uh, factor that we can think of that is causing the depression. So, depression should be considered when a previously well forming children do poorly in school. So, you have a kid who has been doing all well, all right, and suddenly he becomes non-performing, he withdraws from society, or he becomes delinquent with his action. So we as health practitioner should consider maybe the child is undergoing depression. And the predominant mood is actually irritability. So when you observe this child, you would notice the change in behavior. He becomes irritable. May think he's not sad because he's irritable to almost angry. But this is just one of the mood that manifest the deeper issue, which is depression. And this is the important difference between childhood and adult forms. Because in a childhood depression, since the child may not be able to uh, understand that she or he is having depression, the manifestation is in irritability. And when a child is irritable, the way he or she responds to this feeling may be by showing overactivity, by being aggressive, or being antisocial. So it is not always a case of uh, a scenario where a child is sleeping, does not want to get up, very sad. That depression may not manifest like that. It may be in a form of a child who is having behaviors that um, is showing aggression or anger. So, as we said, that depression can be something that is disruptive. Okay. So, when you say disruptive mood dysregulation disorder, it is a condition in children and adolescents that goes beyond a bad mood. It's just not, it is not enough to say the child is not in good mood, but he has become a cause of disorder. There is severe recurrent temper outburst like verbal rage, physical aggression towards people or property, which is grossly out of proportion to the situation. And it occurs more than 3 times a week on an average. So this is not your usual child gets angry because of a situation. This is more of a child angry over simple things and always angry. Okay? So the temper outbursts are inconsistent with the age of the child, and the irritable, angry mood present every day for most of the day, a very observable characteristic. And it occurs not only in the home setting, but in the school and even around peers. The other type of depression that may manifest in children is this major depressive disorder. So from the word itself, this is the feeling of sadness, and really the child is observed to be sad, like being tearful. There is loss of interest or pleasure in almost all activities. Like the child is bored, very, very, very bored. And manifestation wise, we can see that there is a decrease in weight um, because the behavior is not anymore consistent with how the GI system work. There is insomnia, the person or the child cannot sleep. There is retardation or agitation, uh, lack of desire to move, lack of energy, cannot think well, cannot make choices. There's always recurrent thoughts of death, fear, or thoughts of uh, suicidal ideation. The child feels so worthless, unloved, and this can also be with guilt or feeling that he or she is uh, has no value. And the third type of depression, we call this the dysthymia. Okay? Dysthymia is a persistent depression lasting for several days. Okay? Uh, because of this depression that persists, the child may have poor appetite or low weight, but it could also be the reverse. There is overeating, okay? Or lack of sleep, insomnia, because the child is super anxious, or it is the reverse, always sleeping, okay? Which matches with your low energy, low self esteem, poor concentration, feeling of hopelessness. So, by the way, you would say, what is now the difference between the three? Because 1C is persistent depressive disorder, 1B is still depressive disorder, 1A is mood dysregulation, but the manifestations are the same. Well, they're not different. They are all different forms of depression. Um, we are just showing that the depression could be of different kinds, and the psychiatrists will have to have a thorough assessment of the child, what level or what type of depression the child can be on, because as you see here, there are different types of depression, and it's important to uh, figure out where in that depressive state the child is, so the management can match. So as we said earlier, to diagnose depression, we have to go back to history, okay? A deep history, like what could have caused this child to feel that worthlessness inside. It could be domestic violence, uh, um, effect of sexual abuse and exploitation, or use of drugs that has adverse effect on the mind. So when a child is manifesting this depression, it is okay to ask uh, ideation of suicide, or is he attempting to do suicide. The reason for that is we want to know if the child has those ideations, so we can do our one-on-one monitoring to safeguard the child. Now, after depression is diagnosed, the family and social setting or the environment is also assessed to see if there are stressors that is contributing to the depression. Now, how is depression managed? Again, we give medication to reverse the feeling, that is your antidepressant. Do we need to put the child into the hospital? Only when there is acute crisis, like suicidal behavior is identified. But otherwise, this child lives with the community, is managed by the community. So when I say community, we mean here the family, the society, the neighborhood where the child belongs. Another group is your generalized anxiety disorder. Again, when we say anxiety, this is a state of apprehension, excessive worrying, fear. Okay? Symptoms can be tremor, sweating, bodily complaints, exhaustion, always tired. Again, diagnosis is by history. And therapy would be relaxation and the medication. So children with generalized anxiety disorder have diffuse worries, meaning the child worries not only of one thing but of many things. And this worriness causes significant distress to the point that the child will now have impaired social functioning. He cannot study, he cannot complete his assignment. Okay? And so this child is helped on how to manage that fear, that stress causing thoughts. He is helped so that he can relax. Okay. And if even with those psychotherapeutic intervention, then we may have to give a medication that is anxiolytic, meaning anti-anxiety. And these are your serotonins or SSRIs. It manages the serotonin reuptakes in the body and to keep a good mood in the as an effect of this serotonin. Then we have this acute stress disorder and post-traumatic stress disorder. So again, there is anxiety or stress, but these are reactions to a trauma. So it's very clear that the cause is an event. And when the event is recent, so the child is manifesting this stress related behavior due to the recent uh, a recent event, then that would be your ASD. And it typically begins after a trauma and lasts for a short period, 3 days to 1 month. But if the stress continues and manifests for already 6 months, we don't call this anymore ASD, but PTSD, which is your post traumatic stress disorder. Now, treatment is behavioral therapy. And again, if the anxiety is needed to be managed right away, then SSRIs could be given. So, some signs of PTSD in children and teens, as you can see, it's the same with the other manifestations in depression. We have nightmares, insomnia, being irritable, cannot concentrate in school, depression and numbness, withdrawing from friends. In other words, a change in behavior, and the change is more on um, instead of establishing relationship, the child is now letting go or withdrawing from the society. What are symptoms and signs of ASD and PTSD? So they are generally similar, except for the length of time. And symptoms can be something that is intrusive, meaning the recurrence of memories of that traumatic event or flashbacks. Okay, um, there is a re-experiencing of the trauma. It reenacts in the brain what happened in the past. Okay, that is intrusion symptoms. So when we say avoidance symptoms, this is in an automatic reaction of avoiding a memory or anything that reminds a person of such memory. Does not want to go to a place that kind of remind her of a similar scenario, does not want to do activity that will remind the child of a similar scenario. Those are avoidance symptoms. We also have the negative effect on the cognition and in the mood. So there is an inability to remember specific aspects of the traumatic event. There is decrease in the positive emotions, and more on negative fear or negative feelings such as guilt, sadness, confusion. In other words, the as the days go by, the person feel more depressed, more anxious, uh, more defensive whenever he or she recalls the past trauma. So instead of getting better, the child's feeling is getting worse. And finally, we have these dissociative symptoms. Dissociate as if the child is detaching from his own body and lives outside his body. That is his way of coping the trauma that just happened. So, how do we treat ASD and PTSD? So, one is psychotherapy. Now, psychotherapy can be divided into two kinds. It can be trauma focused or the continuous supportive psychotherapy. So when we say trauma based or trauma focused, now the intervention is really focused on modifying the thoughts related to the actual event that caused the stress. Okay, we try to, or not us, the psychiatrist or the behavioral therapist would try to modify the thinking process, the memories, uh, how the person would remember the trauma. And then you have your supportive psychotherapy, wherein, as you can see, the word is supportive, a child who is already able to adjust the traumatic event. We don't stop there after we deal with the child who just had a trauma. The therapy continue. So that's your supportive psychotherapy. There is a continuation with the activities that would help the mind reach the therapeutic level. So this is used to desensitize children to situation that cause them to re-experience the event. As you can see, when the child has PTSD, a certain event that right away would remind him of that past trauma, the child will have all these overt manifestation, being anxious, unable to breathe, increased heartbeat, which is um, not good for the body. And so with supportive psychotherapy, the psychiatrist assists the child so that when he experienced similar situation, that reaction of being as if the trauma is coming back will be managed, and hopefully one day will be removed from one of his reaction. Now there is no drug approved for PTSD, okay? But however, for children, but for the older young population, again you see your SSRIs or serotonins, but not for the very young children. Now, our third group of disorder, remember that mood or that manifestation of a child has become a cause of disorder in the society. So this is now your disruptive impulse control conduct disorder. So what are the different disorders under this? Okay. So I have here a link. Let me open that link. Okay. So here in this link, you can see the different types of disorder that is manifesting overt conduct causing chaos in the society or in the environment of the child. Now, usually this is manifested by a hostile behavior towards authority or figures. Okay, a child being aggressive against a teacher, against the principal, against the parents. Okay, and the symptoms are being angry, irritable, uh, argumentative, defiant, okay, and being vindictive, vengeful. Okay, and this is an alarming behavior. Okay, because it can cause disruption in school or work and affects relationship with the other children. Okay, um, individuals with this defiant disorder will always come into conflict with authority figures. So, if this is not managed, the child, when he grows adult, can always be in conflict with authority. Okay? So, for children under 5, that sign that there is an oppositional defiant disorder, the behavior always occur. Okay, um, observe at least once per week for for 6 months. Okay, and the cause of this defiant disorder is actually not fully understood. Okay, and it is believed to be a product of many things. Maybe the chemicals in the body, maybe the thoughts that the child have, or the experience he have. So in other words, it can be anything. Okay, and as we say, this behavior, oppositional defiant disorder, when this child grows into an adult, he would have issues of conduct or society, being antisocial, or being a problem in the society. Okay. So, oppositional defiant disorder is diagnosed by a psychiatrist. Okay, and it is important for the child to have a comprehensive evaluation uh, to help understand what is causing all these issues. Okay, and how to manage these oppositional defiant disorders. It will be a combination of therapy, not just for the child, but for the parents. Okay? Social skills training can help, wherein the child is taught how to interact better with the children and the adults. Okay? Um, there is an evidence that the type of experience the child have in preschool reduces this oppositional defiant disorder. Okay. Now, some tips to the parents. Okay, if children and teens are very combative, okay, if the problem is severe, that it persists and disrupts family life, remember to always seek care from a mental health care provider. Okay, um, that we have to seek help so we can really manage the behavior of this child and adolescent, so they can be responsible for their own behavior, which is an important rule on safety. Okay? Parents are are taught that they can contribute a lot to that healthy behavior by their behavior themselves. Okay? Parent will have to learn to praise good behavior, but not allow those not good behavior or setting limits. Parents does not have to address all oppositions. The parents would learn how to pick their battle. Okay. So These are other forms of disruptive behavior. You have here your conduct disorder. Again, this is about aggression to person, properties, even animals. Okay. Serious violation of rules, like running away from home, being true one from school, staying out at night. This can be a product of factors such as very harsh parenting style, a child exposed to physical or sexual abuse during childhood, a very unstable upbringing, maternal substance use during pregnancy. Okay. So these behaviors can cause significant dysfunction in home, in school, and people with conduct disorder may deny or downplay their behavior. There is no recognition. Okay? So again, cognitive therapy, this can help children to change their thinking and in the process change the way they control, the way they feel. This is again another form of conduct disorder, the intermittent explosive disorder. This is characterized by temper tantrums, verbal arguments. Now, these aggressive behaviors are not planned, but rather they're very spontaneous. Okay? They happen rapidly when they are provoked. Okay? These outbursts are associated with subjective distress. Okay? Now, in order to characterize that this is intermittent explosive disorder, the affected child must be at least 6 years old because we expect some uh, behavioral management already, like the child can control, supposed to be himself by the age of 6. But if we're seeing all this explosive behavior, then we may start thinking there could be some mental health issues going on. Now, what is pyromania? So we'll just quickly go through each anymore. We don't need to be so detailed. This is just for you to be exposed with these different oppositional misconduct behavior. When you say pyromania, this is fire setting, okay? Setting fire, okay? And a common issue among young individuals. Okay. Setting fires makes them feel pleasurable, which is, of course, not normal. So, how is this pyromania managed? You see the word cognitive behavioral therapy, a change in the thought. Okay. We also have kleptomania. There is an impulsive, irresistible stealing of objects. Child feels happy when he is able to successfully steal. Okay? There is pleasure when stealing. Okay? Although he may not really want to have that object, it is the act that brings the pleasure. Okay, and though this is not so prevalent, but still we have children who have those manifestations. Okay, and then we also have other conditions that is affecting our children. We have now this autism, attention deficit. This is actually your neurodevelopmental, which is the last group of uh, disorders that we will discuss. The neurodevelopmental disorders. What is this neurodevelopmental disorders? So these affect, hold on, let me just X this out. These affect 5 to 10% of the children. Um, this, hold on. Any factor that alters the complex process of brain development. So there is a problem in how the brain developed. Okay, so what are these? When the brain does not develop well or properly, it can affect the muscle, the movement, the way the person feels. So it affects his relationship, the thinking process. So it affects cognition and language. Okay. And sometimes the development, the brain disorder can be so severe that the child may require lifelong support in order to survive. Okay. So what can cause this developmental disorder in the brain? Um, Congenital, something in the genes of the child, uh, or metabolic disorder, uh, such as the way the body undergoes metabolism. Okay. Factors that affected the mother when she was pregnant, okay, or complications during birth. Okay. Maybe it was a difficult childbirth. Okay. And postnatal, meaning as the child was growing up, he may have infections like meningitis or some toxins in the environment that affects the brain development of the child. So what are these brain development issues? It can be an intellectual disability. Uh, this prevents an individual from attaining the skill necessary to perform tasks expected of their age. Like we expect a child at 1 year old to be able to walk, but this child have some muscular issues, which is an effect because the brain was not properly functioning. We expect the child to be already able to say mama, papa at a certain age, but the child is delayed or may not really be able to do it because the brain development is affected. Autism, it has something to do with social ability. The child is not able to connect to his environment. And so there is a problem from the child. How do he tells others that this is how he feels, this is what he likes. He cannot communicate. Uh, he seemed to be having his own world, so there is a difficulty in social communication. The ADHD, which is more prevalent, okay, there is a problem in the attention, okay, because a child cannot focus, he's always distracted. It is now affecting with his learning, his communication skills, okay? Um, and it is considered a form of intellectual disability. So, how again are these disorders managed? It can be a combination of medicine and the non-pharmacological therapies that we have discussed in the previous meeting. We have the individual therapy, group therapy, family therapy. We allow this child to go through those process. The goal is to be able to have a meaningful life. Okay, so those are your neurodevelopmental disorders. So to end this lecture, okay, there is a link here, the last link. Um, if you look at this is actually from the National Institute of Mental Health. There is a discussion here. Why is children's mental health important? It is important as an overall health for children because often we fail to recognize certain issues in a child and in an adolescent. If we were supposed to be able to catch at an earlier stage, then earlier treatment can be started. And when we start it earlier, it is more effective. It helps prevent more severe lasting problem as the child grows up. So in summary, what are warning signs that the child may be having mental health condition? So there is a change in the behavior of the child. Okay, that's the first thing that the caregiver, the family spots in the child. These issues interfere with the child's daily life at home, in school, and with friends. And so we are reminded, and we also remind our parents that those things, if the behavior of the child suddenly changes, there is a need to investigate. Okay? So, what are these sudden changes? There is now frequent trauma, always fearful or worried, always sick, frequent stomach ache, frequent headache, or not anymore studying, in constant motion, cannot sit quietly, or the other way, no activity, sleep too much, uh, not interested in playing with other children. There is an academic struggle, okay, with declining grades, and other manifestation could be just a loss of interest in things, low energy, spend more time alone, diet or exercise excessively, okay, or being suicidal, or getting into those vice, smoke, drinking, engaging into risky behaviors that is destructive, okay, suicidal thought. Okay. Now, one thing we are being taught as healthcare giver is that mental illness can be treated. Okay, we just have to start the care, spot the issue, and start the care the earliest time. And this web page that I'm giving you is from the National Institute of Health. Okay, so it is helpful for children and teens to save emergency numbers in their cell phone if they feel like they want to take their life. They call the suicide crisis lifeline. Okay, 988. We can tell our children that so they can right away have someone to talk to and help manage how they feel. So beneath every behavior, there is a feeling, and beneath each feeling, there is a need. Now, when we meet that need by not focusing on behavior, but dealing on what could have caused it, what could be the reason, and so we are really going deep into the child's emotion and hopefully help the child understand what is going on with him, and the change in that thought or the fixing of that uh, thinking will hopefully manage the child's behavior. Okay, so these are your children and young adolescent. Early intervention is really, really helpful because the management can be more effective, and it reduces or lessen the ill effects when we are not able to address early these uh, mental health issues. Okay, this is where our lecture ends. Thank you very much.